Yo, told that hoe to lock in before I tweak out. Told that hoe to who the is calling me? Hello? Kyle, how you doing, man? Kyle, how you doing, man? Kyle, how you doing, man? Kyle, how you doing, man?
Typically, if your wisdom teeth have not fully erupted,
Yo.
Hey,
Yo.
hey,
Yo. All right, sounds good, man. Yo, what is good, yo? What the is good, yo? What's up, Fur? What's up, Ricardo? What's up, Philosophy? What the F is good, y'all? Told that hoe to lock in before I tweak out. Yo, what's up, Ethan? In the building. We in this bitch lit. Yeah. Ethan, say what's up, man.
what's up? What's up?
Yeah. All right, let's get this thing. So we're reacting to a video right now.
typically,
So why should I keep my wisdom teeth? So a lot of people like question like, oh, like I see a lot of things on Twitter, a lot of things on TikTok talking about, oh, wisdom teeth. Why do we have them? I want to get rid of them. Is it worth it? Blah 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 blah. And people are like, well, I mean, my orthodontist, my dentist told me yes, so I should. So we're gonna watch this video on why you should keep your wisdom teeth. Actually, you know what? Before we start that, let's watch a video on why you should remove them. Let's see if they
They're
mention
erupted.
any. Oh! I don't want to spoil it. Let's see if they mention any sort of study or any bone. Let's see what happens. Let's see what they say.
you're going to want to have those evaluated. Your dentist,
I don't know what he's talking about.
unless you're one of those people who do not develop some or all of their wisdom teeth, at some point, you're going to want to have those evaluated. Your dentist should determine what wisdom teeth you have and discuss the pros and cons of keeping them. There are specific things that you should know before having your wisdom teeth removed. In today's video, we're going to start a multi-part series and discuss third molars, aka wisdom teeth. Hello and welcome to another patient education video. My name is Dr. B, and today we are talking about wisdom teeth. As I was creating the content for this video, I realized how big this topic is, and I decided to break it up into smaller videos.
Okay, so he is very right. This is a actual huge topic. I know I've said this multiple times, but I think it's about 5 million Americans get their wisdom teeth removed every single year, and that's a lot. Out of the entire population, it may not be a lot. I'm not sure about the numbers for other countries, but I know that 5 million people, young people, get their wisdom teeth removed every single year. So that's a pretty big thing, and it should be questioned. So I'm very curious to see what he has to say about why you should remove your wisdom teeth.
In this video, I am going to discuss what wisdom teeth are, what it means when a wisdom tooth is impacted, when should wisdom teeth be removed, and we'll finish up by talking about some indications for removal.
Hey, you wanna put it on 1.25 speed?
Yeah. My guy is talking like a freaking snail. I'm not going to lie, mate.
What it means when a wisdom tooth
Don't
is
care.
often dependent on the amount of space available for them in the mouth.
That's true.
Wisdom teeth can start to erupt in the mouth as early as 15 or 16, but truthfully, the age at which they erupt is individual to each person.
So my question is, if they erupt at 15, 16, would you pull them at 15, 16? Like, what would you do? Like, I mean, obviously, like, you would try to let them grow in, but if they're not impacted, like, I just don't understand, like, why you would be pulling wisdom teeth out of a 15 or 16-year-old kid. That's kind of ridiculous.
Males tend to develop these teeth earlier than males, but by age 25, 95% of all third molars that will erupt are in the mouth. A tooth is considered impacted when it has failed to erupt into the mouth within a reasonable amount of time that it usually should erupt. When a tooth is blocked by another tooth or grows in a way that makes it impossible to enter the mouth normally, it is impacted. Many people have one or more impacted wisdom teeth. Wisdom teeth normally erupt by age 20, but eruption can continue until age 25.
So if that's the case, why are they pulling wisdom teeth at 16, 17, sometimes 18? You know, like that to me is just like, I don't know if they erupt until that point, unless they're extremely impacted. You know, I don't see why the potential is so bad or like should even be like a problem. You know, I don't get that. I don't think that's really a sole reason to pull them so early besides financial gain. What do you have to say about that?
Yeah, I think a lot of the times they're making room in their minds for moving teeth backwards in retractive orthodontics. I don't know this guy specifically, but
right. And I think like people have this big misconception now where it's like, you know, I see people arguing on fucking Reddit of all places talking about, you know, nobody extracts teeth anymore for treatment. Nobody does that. But how many people get wisdom teeth taken out? You know, like get out of here. That's crazy.
The position of the third molars does not change substantially after age 25, but it is possible. There are some case reports of third molars erupting into the mouth up to the age of 40. The most common reason why wisdom teeth become impacted is due to inadequate space behind the second molar.
All right, yep.
The dentist will evaluate you and make a recommendation to keep or remove wisdom teeth based on their eruptive position, your ability to keep it clean, and the presence of diseases such as cavities or gum issues. Keep in mind that some providers recommend removal as early as age 14. Why do you ask?
Yeah, why?
Well, number one, they're actually easier to remove because
they're easier.
They have not completely formed. And number two, the vast majority of people are going to need their wisdom teeth removed at some point.
But why?
Anyway,
but why? So we pull them early because most people need them removed anyways. But why? Oh, because there's not enough room. Okay, but what? Like. That annoys me so much.
Dentist, one thing that I cannot do is predict the future. We cannot predict with accuracy what will happen to wisdom teeth over time. It is for this reason that the recommendation to prophylactically remove wisdom teeth is frequently given. Early removal of wisdom teeth before they are fully formed minimizes risk to adjacent structures and allows for the best overall healing. When you are younger, space where the wisdom tooth was will actually fill with bone more easily and has less negative impacts on the adjacent second molars. As mentioned earlier, the wisdom tooth surgery is easier to perform in younger patients because the surrounding bone is less dense and the roots of the tooth are not fully formed. Based on immature root formation, one of the best times to remove the wisdom tooth will be between the ages of 14 and 20. Any time before age 25 years old is ideal, but some people have to get their wisdom teeth removed older than age 25 for various reasons. So what are some reasons why you may need your wisdom teeth removed?
I just want to punch this guy in the face.
We will look at a full list of reasons, but I commonly tell patients that if wisdom teeth do not have room in the mouth, if you cannot keep them clean, or if there are any signs of dental caries or gum issues, we will most likely recommend removal.
Bro, that's actually so weird, bro. I hope that's not a real tooth. That should look like some roast beef. That should look like my ex-pussy.
Not only do we look for diseases or problems that are currently present, but we also try to predict the likelihood of problems developing later in life based on the current findings during the exam. Let's look at some reasons why you may need your wisdom teeth removed. When the wisdom teeth have partially erupted, some of the dental crown may be covered by gum tissue. This tissue that covers the third molar crown makes it difficult to adequately clean the third molar. Because bacteria and debris can get underneath the tissues covering the third molar, it can lead to inflammation and possibly infections around the wisdom tooth. When the tissue that covers the third molar becomes inflamed, we call it pericornitis. Removal of partially erupted wisdom teeth can help not only prevent pericornitis, but it can also help treat and resolve active cases of pericornitis.
Yo, I'm gonna be real, bro. You talking slow as fuck, and it's on 1.25. That is crazy.
Because the wisdom teeth are at the back of the mouth, they are difficult to keep clean. Even more challenging to keep clean if they are impacted. If you are prone to getting cavities or what we refer to as dental caries, then you
All right, you know what? Let's just get to the good shit. I really don't care what you have to say. I'm gonna be real. Prevention of cyst or tumor. Okay, but how many people are getting motherfucking cancer from wisdom teeth, bro? Get the fuck out of here. That's some bullshit.
your wisdom teeth
You a hoe.
caused by wisdom teeth could lead to more significant problems for the second.
Prevent a jaw fracture. Oh, because if your wisdom teeth growing in provides more jawbone to your fucking mandible and or maxilla. Why the fuck would your fucking jaw fracture, bro? Are you kidding me? The fuck? Stimulation from the wisdom tooth growing in, bro. That's just gonna make your bone more dense. Are you stupid?
Whether you play sports or not, a blow to the face or jaw could cause a jaw fracture. When the wisdom teeth are impacted, they take up a decent amount of space within the jaw, thereby weakening the jaw and making it more prone to fracture.
Bruh.
If you have had pain in your mouth and after being seen by a dentist, they can find no reasonable explanation for the pain and you still have your wisdom teeth, you may want to consider removing them.
All right, so motherfucker, when they grow in, like, why is it like such a big deal if it hurts? Like, of course it's gonna hurt. There's a big here. Let's say this. Of course, if it hurts like so severely that they're like impacted, of course. But like if you have the money and you are told like, yo, if you pull your wisdom teeth or if you get your wisdom teeth pulled, it can fuck up your face, it can fuck up your airway, blah 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 blah. I guarantee you, the majority of people are gonna want to either get expanders or MST. Like, if you're a child and 14, 15, 16, and your wisdom teeth are starting to grow in at least a little bit, and they start hurting like too bad, and your mouth is small as shit, like, why the fuck would you not? Type shit. Like, that's crazy.
Wisdom teeth can cause unexplained pain, especially during their active eruption. Removal of wisdom teeth frequently results in the resolution of this pain.
Okay, so he just said, like, yeah, when your tooth grows in, it hurts. So just fucking put yourself under anesthesia and get it fucking surgically cut out of your fucking jawbone to make the pain go away. Like, what, bro? The fuck? That's like, yo, I have growing pains in my legs. I just want to cut my legs off so I stop having growing pains. Like, you dumbass motherfucker.
So most of the issues we discuss are a result of third molars that are impacted or partially erupted. If the wisdom tooth is deep underneath the gums and bone, you're less likely to experience some.
So like, how many of these is like the majority of people get all of this? It's like, no, these are all like super small percentage of people who get wisdom teeth who have extremely small jaws, which is not the majority, have to get this shit done. Like, you know what I mean? Like, this is the risks of all of those. This isn't just like everyone who gets wisdom teeth or everybody whose wisdom teeth are growing in. They all, this is the type of shit that happens. Like, that shit makes no sense to me. No sense to me. Unexplained pain. Like, bro, like, prevention of jaw fracture, like getting okay, root resorption of adjacent teeth, sure, but like I just feel like it's natural. And like, what's the difference between your wisdom teeth growing in and the other teeth getting a small amount of root resorption and you undergoing 2.5, 3 years, 4 years of braces? Like, what the fuck, bro? That's crazy.
Some of these described issues.
And that shit said orthodontics, bro. For real. And they're gonna sit here and say, "Oh, we don't extract anymore. We don't extract anymore." Shut up.
If the wisdom tooth is deep underneath the gums and bone.
All right, you know what? Fuck you. Fuck this guy. Fuck this guy. We're gonna watch why should I keep him? On God. On God, why should I keep him?
Typically, if your wisdom teeth have not fully erupted, they are challenging to clean. As we get older, our healing response will be less favorable. Ideally, once the wisdom teeth are removed, the majority of the empty space where the tooth was will fill with bone over time. As we get older, the likelihood of bone fill is less and a permanent defect can develop instead. Also, as we age, the surgery becomes more difficult. The bone that was once less dense is now densely calcified and less flexible and more likely to fracture. As we get older, we also heal much more differently than we did when we were young. The recovery period is often longer and more unpleasant with age. Not to mention, as we get older, many patients develop systemic diseases and become reliant on medications that further complicate the surgery. There's no definitive age to draw an imaginary line in the sand and say.
So the reason why they don't want to wait until you're older is because you're going to be on medications and it could complicate you going under anesthesia. Get the, like, what, bro?
That's this age of the wisdom tooth.
Like, what? Does that make any, is that what he just said, Ethan? Like, is that really what he just said?
I think so.
Like, on God. Yo, if your name is Duat, bro, your mom's a hoe, bro. That's all I got to say. That's all I got to say. You should probably leave.
But if the third molar is completely covered with bone and no apparent pathologies are present, then it should likely.
No, just playing. Hey, shout out Duap. Shout out Duap. He's a goat.
Alone, especially if the patient is over the age of 40. As part of a wisdom tooth evaluation, your dentist should review your medical history. As a patient, please try to provide the dentist with as much information as possible. Some patients think that the dentist doesn't need to know that they have medical problems or they are taking medications. And this is a critical mistake and a critical misunderstanding and could become an issue during or after your surgery. Your dentist needs to make sure that you are safe to treat and needs to know if any medication they may give you could be a potential problem. To avoid complications, always tell the dentist if you have any medical conditions.
Yo, so I really don't care. I'm not gonna lie.
Position where its removal could compromise nearby nerves, teeth, or sinus. These complications will be weighed against the benefits by your provider. The lower or mandibular teeth are often closely positioned next to the inferior alveolar nerve. If during the removal of the wisdom tooth, the nerve is compressed or injured, it could cause temporary or permanent damage to the nerve.
So that's actually a really good point. I mean, that's also something that they brush over when you're about to get your wisdom teeth taken out. Actually, they didn't even mention that shit to me. Like, on God, they didn't even say that shit to me. But I mean, when you're getting MSDO or Dame or some shit, like that's also something that they worry about is that nerve. So like to me, it's just like, why would you even fuck with that shit? Like I mean, of course, like impaction, whatever, but like I wouldn't want paralysis in my fucking face, or I'm not sure what all that nerve does, but type shit. Like I don't know. I wouldn't fuck with that shit. I wouldn't.
If during the removal of the wisdom tooth, the nerve is compressed or injured, it could cause temporary or permanent damage to the nerve. This damage would affect your ability to feel sensations in areas where the nerve innervates. Many dentists take a panoramic radiograph to evaluate the wisdom tooth position. Although this radiograph can be helpful in identifying suspected relationships between the wisdom tooth and high, your dentist may look at alternative options such as a coronectomy. This is a procedure where the crown of the wisdom tooth is removed and the roots of the wisdom tooth are left in place. This reduces the risk of the wisdom tooth getting cavities or gum disease and also minimizes an injury to the nerve. Make sure you talk to your dentist about this.
Yo, that's actually, I've never heard of that before. Did you hear about that shit? Do you know about that shit?
What? Gum disease?
They cut the top off. I said the top off.
Wait, can you go back?
Yo, this man really just said they cut the top of the wisdom tooth out. And
this is a procedure where the crown of the wisdom tooth is removed and the roots of the wisdom tooth are left in place.
What, bro? I did not know that shit was a thing. That's crazy. What are your thoughts about that? I mean, I guess you're still cutting into the jawbone, but like
that's strange.
That is really weird. I guess it would provide like stimulation.
I guess you're not taking out the connection from the roots of the tooth to the nerve. That's probably the upside.
Yeah. Like fuck, bro. That's crazy.
This reduces the risk of the wisdom tooth.
That seems a little strange because you would maybe they fill the roots, but that doesn't seem like a good plan to keep that open in there.
I'm not really sure how I feel about that. Yeah, it's so weird.
Getting cavities or gum disease and also minimizes an injury to the nerve. Make sure you talk to your dentist about abrasion or tear in the sinus membrane. If the sinus membrane is torn as you heal from the surgery, it could result in an open hole that communicates reasons why you should not remove your wisdom.
You're really
those reasons being extremes of age.
Reasons they keep bro. He better add. He really better add. I swear to God, he better add. That's crazy.
Compromise medical.
If there's only 3, if there's really only gonna be 3 compared to the fucking 10 he had on the other shit, get out of here, bro. What extremes of age, compromised medical status? Yo, what reasons to keep wisdom teeth? It's like it's not even like a given right. It's just type shit like surgical damage to adjacent structures. Okay, so are these not those minimal risk type shit that he was saying? Like what's the difference between the others he was saying? Like what is the percentage of the extremes of age? Like what? That's so vague. Compromised medical status, like what? I don't understand. Like, oh, you can't go under anesthesia, so oh shit, we can't amputate your fucking tooth. Like what, bro? For real? Surgical damage to adjacent structures, like that's it. They're not gonna mention, alveolar bone on the buccal side dissolves by 50% within the first year and then 1% annually. You're not gonna, mention if you have retraction after extraction, it could fuck up your face or airway. Get the fuck out of here. Like, when was this video posted? Like what, 2021? What, 2020, bro? And that's like that's recent, bro. Like that is so recent. Like I wonder what they were taught in school. Like that's what I want to know is like, are they even taught this? Is this even a thing? Like why is this not even being put on blast, or why is this not even like being given attention at all? Like that's insane. And they pull teeth for jaw surgery too. Like, bro, what? Your wisdom teeth? Like, get out of here. I don't know. What do you have to say about that shit?
Yeah, I think in most cases it's done way too early, or too preemptively.
Absolutely.
There's some cases that it would be worth it, but I think it's pretty rare. Yeah, they're very trigger happy.
For real, that's not even like.
I don't think they really recognize how much bone can be lost around the tooth.
No, dead ass, like dead ass, dead ass, dead ass. Like they do use scare tactics to get people to remove, and that's exactly what the other video was. It was all scare tactics of very rare things happening compared to these very rare things from happening. You know, like it's just like there's like a hole in the plot, bro. Like there's just a hole in their fucking story, and it's just like goes right over their heads. Like it's insane. Oh, that's crazy. That's crazy. That's crazy. Is there a link to fix the lower jaw with if it is small, or should you have surgery at the bottom jaw? Ethan.
Um, a link? What does that mean? Is there a link?
Maybe like a fix.
Yeah, the main thing is go watch Dr. Yusefian's video on this channel. The main thing would be the MSDO or the DAME, where they cut here and then they distract it. I believe that's the only way that you can really get width in the lower jaw, because double jaw surgery just sort of slices the mandible lengthwise and then slides it forward and rebolts it, but that doesn't give you any width. Yeah, so
rarely do MSC patients need more lower jaw expansion. Usually it can work by uprighting the lower molars. That is very true. It really depends on patients, but the majority of people who get MSE, and they're not trying to expand by 2 or 3 appliances, they really don't need any sort of like surgery. All they need to do is expand the lowers or just to meet the top. I know I spoke about this last time, but when I spoke to Dr. Quintero, he was very doubtful of MSE treatment in people who aren't class 3, which didn't really make any sense because it's about the width of the palate, not the placement of it, I guess. But, in their eyes, I wasn't narrow, but here I am now feeling much better, much more, energetic. It's just insane. Like it really depends. He was like doubting. I said, I'm considering doing MSc with Dr. Zabad Nawaz. He's a non-extractive or non-extraction orthodontist who provides MSc almost willingly to anybody because that's just how effective it is. And this motherfucker got so butthurt, bro. He got so butthurt. He was like, you know what? I'm going to be nice and I'm going to allow you to come back here when he fucks your shit up, basically. He was like, I'm going to allow you to come back here when he can't meet the molars. He was like, I invented the TP. I'm like, bitch, shut up. Damn, that man pissed me off. Uprighting. Yes, uprighting is when they tip the teeth typically from inwards to up. They kind of like rotate them. Anyone here do mewing? I have no idea what mewing is. I'm just kidding. Yeah, Dr. Lipkin said, Dr. Tay said, really do that in a patient. Is crane ever worth it? I don't know. I personally don't like crane. I think it exacerbates your forward head posture, and if not, gives you forward head posture.
I think is that the one where it goes to your chin?
No, crane is the one that goes around your neck.
What does it look like?
It looks like you broke your neck and you have a neck brace. Kind of comes up from the neck and it exerts all the pressure into the back of your neck. So crane is, I wouldn't say it's worth it.
Gotcha.
If I wear a MSC device, only the top jaw opens up, not the bottom, if I correct. Yes, correct. Skeletally. Ooh, I can speak on this. I have regular fortune, and it is pretty bad for my TMJ. I got a crane. It's basically bad. It is pretty bad, especially for the price. It is essentially still pushes on the jaw. It does still push on the jaw. It makes you bite down and can amplify any sort of asymmetry. Now I use Orthodontic's bow, and it's definitely the best. I agree. Shout out Patrick. He told me the bow was the best. I didn't believe him until I wore the crane, and I said, yep, he was right. How do they operate the lower teeth if your lower is packed with jaw surgery expansion?
Is the Orthodontic's bow, is that the one that goes on your chest?
Yes, that's the one that goes on your forehead and on your chest. Yeah, that's the one I was telling you about. Is the MSC the only appliance that is worth it? Why doesn't the bite get any attention? The MSC maxillary skeletal expander is an appliance that separates the sutures. And in this process, new bone is formed and fills in between those sutures, which gives you skeletal expansion, not just tooth expansion. So you're not just tipping the teeth, you're literally adding volume and adding bone into the inside of your mouth, which provides, you know, the roof of your mouth is the floor of your nose, so it provides a larger nasal cavity, essentially. Why doesn't the bite get any attention? I'm not sure what you mean by that. Maybe because it messes up your bite, and then you have to correct it post. I'm going to Zabad. I asked for a face mask. Should I only get the bow? Yes. I mean, I'm not sure if he provides it. He might have a few. He didn't have the crane when I asked for it. It's really up to you. It's really up to you. I would definitely get the bow. The crane is comfortable for 5 minutes, and then you realize how fucking shit it is. So yeah, I would definitely get the bow. Ethan, do you have any videos you want to watch?
Yeah, why don't you riff for a little bit and I'll find one.
Say less. I'm gonna stop sharing. So anyways, guys, thank you guys for being here. I really appreciate everyone hopping out. 10 of y'all, that's crazy.
Oh, and is the link in the description?
I'm not sure if I can add it until after, sadly, but I will post it.
Oh, I see it actually. I think it is there.
Oh, you do?
Yeah, let me try. So the link's in the description if you guys want to ask any questions. Join that Discord and post in the general chat or send us a message.
Yeah, join the Discord, y'all. In the description.
Or if you have any videos you want us to watch,
please. We need some. The Discord is lit. We do a lot. We talk a lot. Everyone there is very nice, respectful, polite. Shout out everybody. Alton, I think his name is. We got Yoel, Aiden, BW, Will. You know, shout out all you guys. Antoine. We got Player X. You know, shout out all y'all for real. I really appreciate y'all. Damn, I'm so confused on what to do. Mask, no mask. Definitely do face mask. Bow is worth the investment, even though it is a bit overpriced, personally. It is up to you on what you want to do. But if I could go back in time, I would definitely get the bow instead. So we're going to watch another video here. I got a motherfucking, you know, got a motherfucking. Yeah, okay. This will kill Post Malone.
He was holding his breath, choking for like 15, 20 seconds at a time. So he's like laying back like.
That's me every night.
That man sucking ghost dick, bro. Yo, chill.
Jesus, you weren't gonna let me put my nose
So
on it?
Full screen it.
Yeah, that's been anywhere in a Gabe's mouth or nose.
No, he is.
I wouldn't go near that thing.
Yeah, I don't know.
Don't go near it. It's Gabe's
Crazy
thing.
things.
Stay away.
Yeah.
We don't want to kill. We don't want to kill Post Malone.
Yo, what? I'm confused.
You'll see.
Guys, Derek, moreplates.com. Today we're going to be talking about the dangers of literally dying in your fucking sleep. Yes, I am saying this loud and clear. Get your attention. This is serious shit. This is something that will slowly, insidiously debilitate your quality of life and then eventually result in some cardiac issue or something that kills you early, almost certainly. So in this podcast, Post Malone went on the Full Send podcast, and he's talking about his relationship with Justin Bieber. Preparing for the end of the world is the title. But something that caught my attention is his discussion of his sleep apnea. He talks about it here, how he basically never wakes up refreshed, feels like, you know, perpetually tired, and thinks he needs a CPAP machine.
It feels like, I guess, going on tour, and I guess I just figured out if you have sleep apnea, you're really tired all the time during the day and shit, and you never wake up like fully refreshed. I think I might have to try it.
So here he is.
Okay, I don't know if he's had extractions. If just by looking at his face, I think
he's definitely got veneers or whatever.
Yeah. Oh yeah, that is true. He did get veneers. He had a grill. And honestly, I think his music quality has actually declined over the past 3 years. I mean, that kind of happens when you kind of like become famous and you stop working so hard on music. But I think his music quality just in general has definitely deteriorated. But if you're as talented as Post Malone, like, it may not affect you as, you know, significantly. But I think it is definitely something to think about, how the apnea actually affects your temporal lobes, which is very scary. So,
yeah, and your memory.
Yeah, and your memory too. And the fact that he drinks, you know, 12 Bud Lights every hour is just like, you know, I'm just joking.
Doesn't help, but
yeah.
And you never wake up like fully refreshed. I think I might have to try it.
So here he is talking about a continuous positive airway pressure
CPAP.
machine, also abbreviated as CPAP. And that is something that I use every single night and have used for years at this point. And it's something that has probably prevented me from having a heart attack. I'm not kidding. We'll get into that shortly.
I wanted to get a sleep apnea
I got
machine,
one.
but you need a prescription. Can I hold yours for a minute?
I don't have it here, but I have it on my.
I heard those things. Those things
It's
are
hard to
nuts.
sleep without it.
Is that
though.
the ventilator thing?
Yeah.
Does it
Like, so
change?
Gabe-
It's
Yeah,
the thing that makes
Gabriel.
you look
I
like
told
fucking
Gabriel
Bane
about
when you put it on your face.
Yeah, so it does kind of make you look like, Darth Vader, Bane, whatever it is. Me and Joe Rogan actually talked about this when I was on the podcast.
If she wants to snuggle and you're over there like Darth Vader.
Yeah. But if you don't do that, then you're literally gonna be choking in her face.
Right.
So
Wait, is that the same?
and
person?
one of them kills you quick,
Wait. Is this
and one of them keeps you alive.
At this point,
is that the same person?
Yeah.
Oh,
I feel it's
shit.
probably a good idea to actually define what sleep apnea is for you guys who don't know. It is when you stop breathing for 10 seconds or more while you're asleep. And there's a similar disorder called hypoapnea, which is a partial loss of breath for 10 seconds or longer. And it's defined as, like sleep apnea is when you actually have 5 or more of these episodes of 10 seconds or more of no breathing per hour. So this is something that, every time you stop breathing in your sleep and you deprive your body and brain of oxygen, you're putting your body into a state of unnecessary stress and basically forcing your body into brain damage state, cardiotoxicity state, high blood pressure states. It's just so bad. And you have no idea it's happening oftentimes because it's happening while you're asleep. So even though you're asleep, your quality of sleep is so poor because you're constantly stopping breathing, basically almost getting to the point of passing out from oxygen deprivation. And your body shifts you into like manually forcing you to gasp for air. And this can sometimes even result in you sitting up in your bed, gasping for air in the middle of the night when it gets so extreme. But oftentimes people with sleep apnea have no idea they have it because.
And that is like that's the worst part about all of this is that how severe this is and how it affects your ability to operate as a person. And not only that, but the brain damage, and you don't even know what's happening.
Mm-hmm.
And people wonder why our attention spans are getting worse. Oh, nobody wants to work. Oh, this, that, this, like, I just think it's so much bigger than what people realize. Like I've kind of explained this to, people I meet, friends, and I kind of go into a little bit of detail. I have a good spiel about it. You get to, but I just don't think people truly understand like the severity of apnea and the severity of brain atrophy. And this literally just is killing you. And he said it, but like, it's like, oh yeah, everything kills you. Everything gives you cancer. But it's like, bro, like every single day for the rest of your life, bro. Like you're suffering damage, you're suffering brain damage, especially if you've already played contact sports, especially if you've already suffered concussions, or if you have, if you were in the womb and your parents drank or smoked and you already have some form of brain damage, or, you want to hang on to every brain cell you have. So like, having an underdeveloped jaw and not knowing why you're having breathing problems because you don't even know you're having breathing problems or like what's even going on is the worst part of all of this.
Yeah, and I think someone mentioned in a comment last time about how if you have an AHI score below 5, generally that's not going to be diagnosed as sleep apnea. But if you combine the 5 AHI with the respiratory disturbance index, the RDI above 5 or around 5, I forget exactly, that can almost be just as damaging. If you have, depending on, even just hypopnea could be a lot of the upper airway respiratory restriction syndrome, whatever, UARS, that, is basically going to cause hypopneas, so it's the same process, even if you don't actually snore or have a sleep apnea. Just if you have a narrowed airway, the same thing will happen.
How many millimeters did you get the tooth bone expansion on the lower jaw? I actually don't know. My Hyrax fucking fell out, so I am currently with no expander. If I had to guess, just a few millimeters, probably 3, 2. Not a whole lot. It just uprighted them, and I stopped turning when I thought they were, straight. But I don't know. The Hyrax, I feel like you should only really have it in for as long as you're expanding, because when I took mine out, when it fell out, the gum behind my teeth was extremely like dissolved from where the Hyrax was, and I thought that was, that was crazy. Okay. So yeah, this is absolutely insane. It's actually cool that a lot of people are kind of waking up, at least on a surface level, of sleep apnea and things like that. Because if you mention, oh, sleep apnea, they're gonna say, oh, well, wear your mask, get CPAP. But it's just like that doesn't really like fix the problem, like that.
Yeah.
I think makes it worse long term. I think it's a temporary fix until you can save up for MSE, because I think MSE really like is a cure-all to a lot of problems, a lot of breathing problems, especially if it's done right.
It's happening insidiously, multiple episodes per hour, just slowly destroying your heart, your brain. And when you wake up, your sleep quality is absolutely atrocious, to where even though you slept for 8 hours, you did not get any good restful sleep. Yep. And you end up literally just sitting in class, whatever it is, at work, at the wheel, anything that could be dangerous too, like horrible.
And then they go and say, oh, this is ADHD. Oh, you have ADHD because you're not paying attention. But in reality, you're sleep deprived. And then they give you stimulants, which makes it even worse, which just amplifies the problem. Now, you're on long release Vyvanse and you're struggling to fall asleep. You actually fall asleep 1 o'clock, 2 o'clock, wake up 6 o'clock to go to school. You do that shit for 2 years in a row. My God, bro, that's fucking destroying your brain. It's frying your brain on top of the sleep you're not getting. Like, I can't imagine, bro. Like, we're literally living, like, this is a hidden epidemic, bro. This is a hidden epidemic. This is so sad.
Horrible. Like, you could, like, there's arguably nothing worse than being this underslept while you're behind the wheel. And you, like, obviously, individual dependent, context dependent, of course, that's variable. But like, literally when you're unconscious at the fucking wheel because you're asleep, like, that is a common scenario with people who are this underslept. I remember when I was in university and I had my sleep apnea first getting discovered. It was discovered as a result of a really aggressive dirty bulk phase where my neck size got to bigger than it's ever been. I had the highest blood pressure and the worst metabolic health of my life, essentially. And I would literally sit down in class and within 1 minute start falling asleep. Like, it was that bad. And we go into this in more detail in the Joe Rogan podcast. I think it's definitely worthwhile to watch because we both had our own ways of attenuating it.
What have you done for your sleep apnea?
CPAP.
Oh man,
bro, imagine somebody watches our channel, somebody watches JawHacks, somebody watches Jawley, Ethan, and they become aware of the possibility of MSE, the possibility of correct headgear, and they go on Joe Rogan and explain it to this man. It will blow his fucking mind. He knows the guy who wrote Breath and Jaws, and this guy, I'm sure it's being like brought up to him. Oh, sleep apnea is bad. I gotta wear my mouth guard. No fucking oral support, no mid-face support beam for my face. My face is collapsing, Joe Rogan type shit. Like,
there's people just think it's either just tooth expansion only or only surgery. But this is a really good intermediate, especially for people with sort of moderate sleep apnea. I've heard a lot of these guys talk before, and none of them, like, it's always CPAP, which is so strange because a lot of these guys are super into science and anatomy and mechanisms of things, and it's so kind of a no-brainer when you can't get enough air in either your nose or if the restrictions behind your nose or behind your throat. It's like you got to address where that actually is, not just force air in your mouth. I mean, I don't know. It's still better to have that than nothing, but
I agree.
It just doesn't work for most people, and it will recess over time.
Yeah, I think that pressure of the CPAP on your face is something that is very undermined. And I think MSE and its ability to expand transversely and with combination of the right headgear to protract can actually eliminate your breathing problems, and if not, make them better than they were or could have possibly been. I think you can achieve something very similar to jaw surgery without actually doing jaw surgery, airway benefits wise. I'm not talking about.
Well, so I would also say that Daniel said, that MSE is just transverse, and according to Dr. Yusefian, it, depending on the patient, can give 4 to 6 millimeters forward expansion as well, especially when you keep the teeth forward with the arch support. And then the same thing for the lower jaw. You're doing DAME or MSDO. Except you're only going to get like 2 or 3 millimeters forward growth. So it can help a bit.
Agreed. I think it does protract slightly, but that's just the bone kind of like bowing, kind of bending a little bit. I think. I mean, it does kind of come forward. I don't know shit. I don't know shit, but I'm just kind of guessing.
No,
here.
it definitely does come forward because people have improvements with the
zygomatic.
Well, not the zygomatic, but basically the back of the palate where it's contacting the back of the throat. Like that's where my main restriction is back there. So the airway behind my nose sort of looks like this, and then the soft tissue will get stuck when I try to breathe through the nose, right? But if you even just get a few millimeters, forward, that can make a big difference. Not for everybody. Like jaw surgery will get you like 10, 15 millimeters max forward, which is way bigger. But
right. It's important to remember each millimeter provides substantial improvements with breathing and also aesthetics. If you do MMA, holy shit, it's ridiculous how much space you get. That is very true. I'm not hating on MMA. Me personally, I just don't have the money, and I don't want to approach a surgical route solely based on the fact that I want to explore the possibilities of non-surgical routes and maximize the potential of it. And I think that it gives you more control and also more mindfulness about your body, mind, posture, and all of that compared to just getting jaw surgery. And the price.
Something I mentioned last time was that with my situation, I'm similar that I don't want to go to the surgery immediately if I don't have to. But getting that wider foundation of bone in your upper and lower jaw before you slide it forward is going to make a big difference, because you're not going to get all the changes in these bones throughout the eye, and the zygomatic bone and the sinuses, which are a big deal. They're not. It's not just like you want to get MMA with the Lefort 3. Or Lefort 3 or 2, I don't know, the one where they cut it basically between these two teeth and then into 3 pieces, and they slide it forward and bolt it back on. But when you bolt it back on, you don't get the facial changes. So
fuck MMA, man. That shit can ruin your life if it's done in the wrong. If it's left in the wrong hands, which is why I worry so much about doing non-surgery, because I don't trust orthodontists. I don't trust these surgeons, because if they can willingly extract your teeth for MMA, why on earth would I trust them to do surgery? Especially on my face. I don't know. Maybe I just don't know enough. Should you worry about gum recession occurring with an expander if you have it in for over 6 months?
What kind of expander?
I'm assuming he meant tooth-borne. But MSE, I don't think so. I really don't. It doesn't really.
It will. Yes. Because if you have MSE done, most people, you're going to need some orthodontics to some extent to change your bite, and that will dissolve your bone and cause recession to an extent.
Ron said that we'd start focusing more on MMA-centric content this year. When can we see more MMA content coming up? Would love to see sticks again. More MMA content. I'm not sure who he's currently in the works with on interviewing, but he had that same conversation with me and a couple people behind the scenes about being more knowledgeable about MMA and its possibilities as well. So I'm not sure when new content will be coming out regarding this specific topic, but I know that he would be heading in that general direction very soon. They say if you do MMA on shitty posture, you can get out of that posture because it's stuck. I agree with this. That is true. We need more MS.
Yeah, and I think that it similar, since it's not changing any of these facial bones, if you have some sort of asymmetry, as I do, that is deeper within the skull than just the zygomatic bones or the maxilla, it will keep those, and then it will put force on the bolts that reattach the maxilla, and it's not a good situation if you don't fix I think if you have a super narrow palate and you just slide it forward, I think it's just going to cause the teeth to hit back way more. And I'm not a fan of it. Yeah. Skeptical.
They're not very, they're kind of annoying to have to wear, but I'm so used to it at this point. That's just part of my routine. But
I have a mouthpiece that I wear that keeps my tongue from falling back. A lot of the thick neck guys like you, what happens is your tongue falls back because you have all this extra tissue around your neck, so your tongue will fall back and cover your air hole. That's why you choke and snore real loud. Well, this tongue depressor, it's like a mouthpiece, and it holds my tongue down, so it keeps my airway open.
Oh, nice.
It's amazing.
Yeah, I think that's one of the most overlooked silent killers of muscular guys.
Yeah.
That is true. I think the soft tissue enlarging can fuck up your airway. I also think that when people squat or when they power lift like that, they tend to develop a bit more of forward head posture due to the natural ability to open the airway when you look up. So I think that's also a contributing factor of bad posture. But I also think something that was extremely overlooked, and if there was somebody to connect the dots, what he just said is that his tongue gets up out of the airway. But if you look at his face, I know we've already kind of like analyzed his face. He has very flat cheekbones, even though this man has a fucking humongous head. Jesus Christ, he has
a lot of this is the growth hormone that he's used.
That is true, but it's amplified by the collapsing of his midface because he does not mew.
Part of what I mean though, the growth hormone is that it makes your head wider, but it also grows all the tissues inside your nose, and the reason he has these folds here, right, and all the skin, so it can actually make your sleep apnea worse. Because a lot of these guys take a lot of growth hormone.
Looking at pictures of Joe Rogan when he was young, he did have pretty good structure until he started taking growth hormone. And I'm sure once he started taking that growth hormone, it enlarged his tissue. He started having breathing problems. And then that's when he got the mouthpiece.
Well, I think he's been a mouth breather his whole life.
That is true.
But then I think he got like a septum surgery or something. But I don't think he ever actually addressed the maxilla.
Well, his palate is really narrow. So is his nasal cavity.
Yeah, he's got the black triangles for sure.
Which leads to airway resistance and the negative pressure can help. So with the tongue, not to mention the tongue will be where reserves space really from the narrow intermolar width. That is true, but I don't know if maybe his tongue is just fucking humongous because I'm not sure if y'all ever have seen this man open his mouth or fucking smile, but he has a very large, broad smile. It seems to me that he has a large IMW, but I don't know. I don't know for sure without like fucking looking inside his mouth.
Open. Oh, nice.
It's amazing.
Yeah, I think that's one of the most overlooked silent killers of muscular guys.
Yes.
And fat people.
Yep.
Yeah. Because you don't even know you're getting fucked up in your sleep. Yep. You wake up and you just feel terrible. Like I used to go to university classes and sit there and not understand why I'd fall asleep after 5 minutes every day.
Right.
And the lecturer just thought I was a shitty student. But in reality, my sleep was just atrocious the entire time.
Yeah.
And the CPAP is a game changer for me because otherwise, I was getting, I don't know, like I forget how many episodes of apnea I was having per hour, but it was exorbitant to the point that I probably would be dead by now if I didn't get a CPAP otherwise.
Oh, yeah, because you get sleep apnea. This is for you. No. I love how stoked he is about this because this is like when you're this like rich and successful, it's like not like what gets you going at this point. The guy's got fucking Bugatti, he's got huge mansion probably. He's got the most success, the most fame, everything you could ever want. And then he's like, holy shit, something that actually improves my quality of life and makes me healthier. He's fucking thrilled. Love to see it.
This is crazy.
Wait, you have a snoring problem?
No, I just wake up and I don't feel super refreshed and I'm constantly tired throughout the day.
So yes, this is a very common outcome, constantly tired throughout the day. Even if you sleep for 9 hours, 10 hours, it doesn't fucking matter because you are literally going to war in your sleep every night. Just trying to get into deep sleep, trying to get your high quality sleep in, and it's just not happening because your fucking body will not let you. You are literally choking slowly to death, essentially, while you sleep. It's like manual asphyxiation of your fucking throat. Like you have your tongue dropping back, your throat itself is too large because you're muscular or slightly overweight or very overweight, whatever the case may be. Like even if you're shredded, dude, this is something that can fuck you up too. How many bodybuilders have chronic, brutal sleep apnea? A lot. And here he has a nose mask that's actually the exact same nose mask that I use personally. And I also use
I was muted. It looks a little bit recessed, I'm not gonna lie. It kind of looks a bit recessed. What do you think?
Yeah, I mean a little bit, but go to Hassan's comment. So yes, HGH definitely does increase bone density, but it's non-selectively growing all tissues in the body. So if you're going through expansion, HGH will be helpful, right? Because it will solidify the new bone. But just because it's growing the facial bone and its density doesn't mean that the soft tissue isn't also growing and crowding the airway more. That's the reason that you get turbinate reduction, is that the soft tissue just gets swollen and swollen, right? And it's not necessarily swelling, but it's physically growing it, which is why you get the HGH head and the jaw, and why bodybuilders get so much growth in their face and their jaw muscles.
Yeah, it's sad because like I just it sucks. I wish there was a workaround to all of that because HGH, like if I was that fucking old and I had the money and my fucking test levels were so low, of course I'd be on some sort of testosterone replacement therapy.
Yeah, well, it's really not an issue if you're doing it with that issue, with the airway issue in mind. You know, like I've used growth hormone and I've used MK677, which is basically releases growth hormone. One guy mentioned it in the Discord with his trying to grow taller experiment, which we'll talk about. But you can get a lot of benefits from it, but you have to cycle it, and you can't have the constantly elevated growth hormone all day, every day, because it will really fuck your I mean, it will grow all tissues, so it'll grow your organs. It's not a good thing to have a ton of it all the time, but it's a very beneficial compound and pretty low risk. So yeah, I do plan on using it during my expansion. It will be I think it's a very helpful tool for people to use, especially because it increases the bone density. So when you're filling in that new bone, it will be very helpful to have as much as you can there, and it will also grow your gum tissue, which could be helpful.
Oh yeah, that's right. That can help like with alveolar bone.
Yeah, exactly. Yeah.
Mouth shot, because some people who are very prone and subconsciously mouth breathe, they will have this thing and it'll blow air through your nose. But if you mouth breathe normally and you're trying to encourage nasal breathing, your mouth will hang open while you sleep and all the air will escape out your mouth. So I used to use a full face mask and then I transitioned to the nose one to try and encourage better breathing habits. But some individuals with brutally deviated septums, harsh, turbinates that are always inflamed and they can barely get air through their nose. People with allergies, like you may need a full face one, but this is, something that will be life-changing for him.
Hey, I heard it's bad for you if you don't have it. Maybe I should talk to a doctor though first.
It's not just bad for you. It will literally fucking kill you years in advance. Like your quality of life right now compared to what it will be post CPAP, not even comparable. In addition, your heart health, your brain health, like you're literally killing brain cells in your sleep right now.
I thought that was a snoring machine, Gabe.
So what happens is, like a weird XLR cable. Good.
It's actually a gaming machine.
Not the sleep apnea shit. No, it helps you. It just does oxygen? It pumps oxygen in you?
I thought it's not.
I don't mislead.
Yeah, continuously pumps oxygen. It manually adjusts how much pressure is needed to based on what your needs are. And it tracks how many episodes you have per night, per hour. And it gives you a lot of feedback in terms of if you are improving or not. And it's a fucking game changer for guys who need it. And we even talk about like how weird or awkward it might be to have around chicks in the Joe Rogan podcast. Definitely recommend checking it out. And it's something that is, shouldn't be overlooked regardless of how, awkward you find it, how, weird it seems. Like once you get used to it, it's not a big deal. Chicks don't care. And if you need it, like with Joe, he had the tongue depressor, which works for him. Some individuals need CPAP though. Some people, they will not get away with just having like a, I don't know, taping their mouth shut or like doing.
You're a bitch. You should have.
It would be I would really like to see either Ron or somebody talk to this guy and a few of these guys in this space about the different options for expanding other than CPAP.
Right, and the importance
or double jaw surgery.
Absolutely, and the importance of nose breathing while you're sleeping, and I mean just having at least proper tongue posture while you're sleeping, because I know your muscles relax and it's hard to, but if you habitually mew, your tongue will naturally rest at the roof of your mouth even when you're asleep. So I think like that support beam can really help prevent the midface from collapsing, and I think it is a very underlooked problem, especially with people who, just get the mouth guard, just, blah, blah, blah. But that promotes mouth breathing. That promotes, just the benefits of nasal breathing while you're asleep are I don't know if there's studies on it, but I know I've read a couple articles. I'm not sure how entirely accurate they are, but I can imagine nasal breathing while you're asleep is much better than mouth breathing, even though you probably do a little bit of both.
Yeah, it's changing your sleep cycle as well.
Yeah.
The tongue depressor thing.
But yeah, Ron talking to these guys would be fucking amazing. We're manifesting that. That's this dude. I don't even know what's your name. More plates, more dates. Yeah,
Derek.
Derek, you're gonna be on this channel, my guy.
People need this machine, and it will literally save your fucking life.
Anybody.
I'm very happy about how enthusiastic and passionate he is about the importance of sleep apnea and preventing and curing sleep apnea and how it affects your brain, because he's pretty black coat on that shit, which is cool.
You'd be on that thing, huh?
What happens if you don't have sleep apnea and you use it?
It might be better. I heard LeBron James with it. Just like
I heard it's bad. I heard you need a prescription to get one because it's bad if you don't have it and you use it.
Oh, we don't want to mislead anybody then. We don't want to do that.
What?
I actually have no idea, to be honest. I would assume that nothing would, I don't know what would happen that would be bad. Like if anything, it's just providing you air that you would have already had otherwise. So I don't see how it could be bad. I'm not necessarily saying it's useful though at all.
Maybe inflaming the turbinates or the soft tissue. I've heard that be a problem with people who use CPAP and they're undergoing MSE. The air is just too much and it can inflame the soft tissue and in your throat and stuff. But I'm not sure if that's like completely terrible, you know. But I'm blocking this up. Man, I thought Post Malone was here.
Yeah, we got Post Malone.
Yeah, he's in the back room right now. He'll be back. He'll be back. Just donate $50 and he'll be back.
So I don't know. That's an interesting conundrum though. The weird, crazy LeBron. I wouldn't be surprised if LeBron fucking needs one though. The guy's got a huge neck, I'm sure.
Expensive and insurance will cover it. That's what insurance. I don't think.
Gabe, they're $900.
Jesus, you were gonna let me put my nose on it?
No, don't touch that thing. If that's been anywhere to Gabe's
Yeah,
mouth or nose.
No,
don't
he
touch
is.
it.
He's gonna charge you after, but it's like whatever.
So I wouldn't go near that fucking thing.
Yeah, I don't know.
Don't go near.
So yeah, they are pretty cost prohibitive, unfortunately. However, they last for a very long time. Very, very long time. I still have my first CPAP machine from, I don't know, like a decade ago or something. And it still works. You know, I've upgraded since then because they've come out with new models and whatnot that are better, but you know, it still works. And it is covered by insurance a lot of the time too, depending on where you are, depending on the context. But it is something that like you could not have a better use of money. If you need this, like this is the game changer. Like any kind of nootropics, any kind of performance enhancing, anything, exercise, nothing you do could account for the improvement of your quality of sleep to where it needs to be if you're like totally healthy. This is like I cannot overstate the importance of this enough, and it's hard for me to find opportunities to talk about sleep apnea in videos that'll actually get traction. So this is why I'm very glad this came up, because how often am I going to get like a video where a celebrity's talking about fucking sleep apnea and how important it seems to be for me to actually like hammer this home?
Here, it's Gabe's fucking
crazy
thing. Stay away.
Yeah. Maybe you should game with it.
We don't want to kill Post Malone.
Is it on or not? You won't kill. It's oxygen.
I don't know. Maybe
It's okay. I like holding it.
Yeah,
I definitely feel better already.
They do say it does wonders though for you.
Yeah, it's literally like entering a haze, exiting a haze that you didn't even know you were in for fucking years.
I want to try it.
It
I mean,
does.
I guess who do you talk to about this type of thing?
Gabe,
I'd
no
probably
idea.
consult a
guy, yeah.
physician.
There are sleep doctors. I forget what their specialty is called. Like, you know, when you have, you know, endocrinologist, dermatologist. I forget what the sleep doctor is called. However, there are sleep specialists that will assess your sleep apnea, likely give you a pulse oximeter to bring home to actually assess your, your oxygen levels throughout the night. And if your oxygen saturation levels dip below a certain point and you have a certain, like duration of apnea episode, and there is a frequency that is concerning, you know, you'll get red flagged and go in for, they would likely recommend a sleep study where you then go into an actual like facility that is designed to assess with very, very conclusive and intricate detail the architecture of your sleep and how shitty it is and kind of diagnose you officially.
So I think another problem that is apparent is the lack of awareness of UARS and how that can affect your sleep and everyday life. I think it's very overlooked and kind of swept under the rug and seen as not as big of a deal or problem due to the severity of OSA or central sleep apnea. It's just, I think UARS is just as bad, if not right up there, and should be at least like, oh, hey, you know, of your age group of healthy people, you should be here. But compared to the average of people with fucking terrible sleep apnea, you're not quite terrible, but you're not up where you should be. So we're gonna do nothing about it. Like, that makes no sense to me. That is pretty stupid. I think if you come in and you have breathing problems and you're suffering from any sort of breathing problems, what would be the downside of prescribing somebody with a CPAP machine? Like, it doesn't make sense, at least temporarily. Like, I guess because it's covered by insurance, but still, like, if you want that shit, you should be able to have it. And yeah.
And then from there, you would get probably prescribed a CPAP machine if it's bad enough. And I had severe obstructive sleep apnea to where it was like a no-brainer. Despite my young age, it was like so fucking clear as day. Oftentimes, the clients in these like sleep clinics are, you know, 40, 50, 60 years old. But for people who are in the fitness industry, bodybuilders, whatever it is, if you have a large neck, very common, even if you're lean. And for individuals who are overweight, regardless of your age, also very common. So be fucking careful, dude. Like, a lot of people have no idea they have this until they have a partner that actually tells them and makes them aware. And it's like, you know, a lot of times the partner doesn't know either, though. They just think you're annoying. You snore like a motherfucker. And they're like, oh, that's brutal snoring, even though you're literally choking to death, essentially.
Just all the time. And then I wake up and I don't feel good. Like, I don't feel like 100%. And then throughout the day, I'm just like, oh, man, I'm so fucking tired.
Do you drink a lot of caffeine?
Yeah. I mean, yeah. But then I see, like, my friends, they're like, you know, everybody's doing their own shit, and then I'm like, I want to hang out with you guys, but I'm so beat. And
yeah, so if you're using, you know, caffeine to try and attenuate the, you know, sleep deficit you're perpetually in, like obviously at some point you're basically burning the candle at both ends. And it's like, while caffeine may offset the sleep-induced like performance limitations that you have in all capacities to some extent, like it's not going to be a band-aid that fixes the issue of you getting like shit quality sleep every night. So him saying he's always anxious, you know, emotional instability, being more depressed, like all of these things, like the impact of sleep on your mental state as well as body composition outcomes and like everything about your fucking life is so massively impacted by sleep quality. It's insane. Like even going from 8 hours of quality sleep per day to like 5 or 6 can make the difference in your total testosterone levels of differentiating you from like a healthy young man and like a middle-aged or elderly man. Like that's
absolutely.
Yeah, and I believe Brody Oliver, you know, mentioned, you know, like why are we talking about steroids? You know, many reasons, but you know, last time we talked about one guy who is in the Discord who is, you know, a lot of these guys are just super hopeless, right? And, you know, they got their testosterone tested and it's like, you know, in 350 nanograms per deciliter. And, you know, so, but they wanted to get on TRT, you know, people are just looking for, you know, and this other guy as a teenager used growth hormone secretagogue to try to go taller. So we're not recommending anything. This is not medical advice, but we were talking about the growth hormone in relation to, you know, Joe Rogan's change in his face and his head, and as well as the fact that these things can be used in a short-term basis, not a long-term basis, in order to improve the recovery and incorporation of new bone while you're expanding. It's definitely not going to expand your face at all. Like it will expand the width of your face, but it will make your breathing worse. And obviously growth hormone is not a steroid at all. It's not a steroid. It's just a peptide hormone. But it's very well documented that this stuff can be used very intelligently with low risk. But you should obviously do that with a doctor if you can.
Absolutely.
And you just need to go about it intelligently. But that's just for personally, I plan on doing a little bit of that augmentation, as well as certain, basically there's a few different ways that you can augment the recovery from the surgeries. Yeah, HGH doesn't cause cancer, but it will definitely grow cancer cells that are already existing, which is why I am not a fan of being on it every single day for years. But if you're gonna have a surgery, you know, having a few of these peptide hormones at higher levels temporarily, it can be very beneficial, and it will not. You're not gonna grow any significant cancer cells in that period of time, unless you have significant amounts of carcinogens in your body for whatever reason. But you know, high insulin from eating a lot of sugar is also going to feed that, right? So if you have your shitty diet and you're downing a ton of HGH, it's going to be way worse for you than if you're on a low sugar diet, or just a healthy diet in general.
That's how dramatic it can be. So for him, I'm sure his hormones are all, you know, have been had detrimental impact on them. I'm sure his mental state is far worse than it would be otherwise. I'm sure he's more emotionally unstable. I'm sure he's less likely to be just in a good mood, you know, by sheer lack of sleep quality. All of these things massively impacted, and it fucking sucks because a lot of people go their whole lives without even realizing it. They end up with a heart attack. They end up with, you know, shit quality of life. They end up with worse body composition. Like all of these downstream impacts that impact everything, you know, the relationships with people, worse quality, their communication skills, everything. It's all massively impacted by sleep.
And I'm like, you guys don't live necessarily a healthier lifestyle than me. Yeah. Why can't I hang in there with you? And on tour, it's just like, I used to be able to go and drink and party and hang out and shit, but now I can't do it. Like,
yeah. So again, it's not like when he's saying you don't have a better lifestyle than me, like you don't do better things than I do. You know, that could be true. And I'm not necessarily saying what he's done has got him to this point, like he fucked up or something. Like I had sleep apnea and continue to persistently have it. And I have like a structural issue. I don't have like an electrical signaling issue. For me, my tongue literally just falls into the back of my throat still when I'm sleeping. And I am a back sleeper. So again, if you're somebody who's comfortable on your back and that's just naturally where you lie, rather than somebody who lies on like their face, essentially, if you're lying on your side and your face while you're sleeping, obviously your tongue is not going to naturally fall into the back of your throat. But if you're lying on your back the majority of the time you sleep, which some people just naturally do, and you can't like tell your brain to not fucking do that, your tongue might fall into the back of your throat and cause sleep apnea, even if you're shredded. So it doesn't necessarily, I'm sure his lifestyle choices don't help. Like obviously his body composition could be better, but it's also a vicious circle where the sleep is fucking up his ability to get a better body composition too. The impact on poor sleep on ghrelin and leptin modulation, which is your hunger hormone signaling versus your satiety signaling, so impactful. The likelihood, I think it's like just having like 5 or 6 hours a night versus 8, the impact on overeating was like an extra 300 calories a day, which equated to like 70,000 calories per year or something. I forget exactly what the statistic is that Matthew Walker, who's a great leading researcher on sleep research, and his book, Why We Sleep, also a great read, definitely recommend it. Or his Rogan podcast, excellent, concise summarizations of his research as well. But basically, like the probability that you overeat or choose poor food choices, so much higher when you're underslept too.
Like I can't. I like get off stage and I go to bed and I feel like a piece of shit. Like my back hurts, my legs hurt, and I don't know.
What do you do for the anxiety?
Okay, I just went to cross-reference the mathematical calculation on the extra calories eaten by individuals who are underslept because I knew that sounded kind of weird, but 300 to 400 calories per day apparently is the actual metric that underslept individuals overeat by, and their choices in food selection are often much worse. So that equates to about 110,000 to 146,000 extra calories per year. And if you want to divide that by however many calories are in a pound of fat, you're looking at like an exorbitant amount of extra fat you could be packing on if you're in a surplus. Like if you're at maintenance otherwise, and that your undersleptness is what pushed you over the edge to be eating in a 300, 400 surplus this entire time. Obviously, you will have some metabolic adaptation where your NEAT changes and whatnot. But again, like your food choices are going to be poor, much worse too. Like you're looking at multiple extra pounds packed on insidiously just by your deprivation of sleep.
Are you a medicated guy, or do you do natural ways?
No, sir. I want to go and check it out, see if there's any way to help. But I mean, right now I just kind of hang out with it,
right?
Make it work.
So medications. Like what is the best prescription you'd be taking for his mental health, emotional state, etc.? High quality sleep. The sleep apnea, that's got to get fixed, dude. Like this is 100% the root, like the main foundational backbone of everything that is related in your life to issues from a mental standpoint, a physical standpoint, blah, 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 is going to stem back to your sleep quality. And after that, you can dial things in above and beyond that. But this is like bare bones. This will be the biggest meat and potatoes fucking thing of your life that changes everything.
Yep, I agree. Absolutely.
Bad days, like it Bales does.
Very much so.
Yeah, because when I have bad days, it's the worst. You wake up, you just know it's that day. There's nothing. And then once in a while, I'll do an occasional Xanax to help. But at the end of the day, they say
what the fuck, bro? What the fuck? Did you just say I do the occasional Xanax? What the fuck? Why are you popping Xanax?
Not the best.
Yeah, well that makes your sleep apnea so much worse because you're inhibiting the arousal from the apnea. So,
dude, what that man is talking like Post Malone's a 2016 SoundCloud rapper, bro. What a dumbass.
Fucking Band-Aids, dude. All Band-Aids.
Option.
Right? Yeah, all Band-Aids, like he was saying.
I don't know. I'm just trying to make it work.
Has it always been like this for you, or is it something that's happened recently?
I feel like it was a more recent thing. I
apparently smokes like multiple packs of cigarettes a day too, which obviously doesn't help either.
I used to smoke weed a lot,
which destroys your REM sleep quality. It helps your sleep latency, but destroys your REM. Your quality of sleep goes to shit once you start relying on THC. A lot of people think like, oh, I get to sleep so much easier with it. Yeah, your actual time to fall asleep can improve, but after a while, your REM goes to absolute garbage, and you end up reliant on that THC to actually get to sleep too, whereby you end up essentially just degrading your quality entirely. Not entirely, but it's like quite significantly a detriment to your quality of sleep once you get reliant upon THC. By the way, this machine, I don't know if this is actually CPAP or not. There are different types of machines. There's a automatic positive airflow pressure machine as well. APAP, there's also a bi-level positive airflow pressure machine, BiPAP. Now, when it comes to CPAP, APAP, BiPAP, which one is the most suitable for you? Talk to a sleep doctor. Don't just go by this video and be like, oh, CPAP's the one I need. Could be entirely different. Some people can't tolerate CPAP forward procedures, whatever that would be called. I'm not exactly sure the exact name of the procedure, but there are a lot of options. But in general, getting it taken care of immediately, at least in the short term with a machine, probably the best bet and what a lot of sleep doctors, I imagine, would recommend. But worth looking into all of these solutions, like the impact. Again, I can't iterate enough. Quality of sleep, so fucking important for everything they're talking about.
Are you a hot sleeper? I'm a hot sleeper too. I like it.
Hot sleeper, again, huge impact on sleep quality too, is the temperature of your room. If you need to drop it to, I don't know what it would be in Fahrenheit. I sleep at like 18, 19, something like that. And it is, if you sleep, you'll notice your sleep quality in the summer, if you don't have air conditioning, terrible compared to in the winter. Like there's a reason for it.
I agree.
Rip that shit.
I like that. I've been on for 2 years.
I don't think he wants to.
Really?
Like,
You should not try that one.
Wait, yo, Post.
I
You're hesitant because it's gay.
Right,
So what's
no,
going on here?
I don't think he doesn't just my nose.
Yeah.
Oh.
He's not missing anything by not doing it.
Imagine being like one of the podcast employees and they're like, give your fucking nose mask to Post. Just like, you let him stick his fucking schnoz in it, bro. And then like right when you get home, you're gonna have to change it and hopefully have another replacement one.
Dude.
Yeah. Man, his tattoos are sick as fuck. But yeah, I don't know, man. BiPAP, CPAP, Post Malone, get your ass a fucking one of them bitches. I don't know what to say to you, man. It's pretty crazy. Am I muted? Not yet. Fuck. Yeah, do you want to
let me get this video. Hold on. Yeah. It's another one from this guy. I just want to show people.
Here, you can share your screen.
Well, I want to show people the
I'll be right back.
Gain size of the head. So let's see.
You should be able to just share your screen, I'm pretty sure. Yeah, I'll be right back.
this one. Yeah, so this is going to show us the changes in the head that happen.
Hi, Derek from preventive.com. Today I wanted to talk about something that I don't really see talked about and I found kind of interesting, and that is the effect gaining muscle has on your literal face tissue. So the easiest way to illustrate this is to just show you some before and after pictures. So for example, if we go back to the start of bodybuilder careers when they're amateurs, you'll notice when they get shredded, their faces look great, really stuck in, really chiseled and lean and defined, and that classic death face look you get in prep when you get super lean. These guys all had great death faces. Dorian Yates, Phil Heath, Guy Green, solid death faces. And as their careers progressed, all these guys I would say should be considered mass monsters at one point. Phil Heath is probably a bit of an exception because his weight on paper perhaps doesn't reflect that, but he's obviously tried to maximize his size before and it worked against him. So I think he's kind of like crosses into that threshold of gaining more muscle than is necessary on your frame. And Dorian Yates, for example, he's a great example of what's going to happen in your face when you gain a ton of muscle. The first guys to blow up in that sort of GH insulin era or whatever you want to call it. And his first few contests, face super chiseled. You'll notice as he gets older though, he gains more and more muscle. Despite being as lean or leaner, his face continues to gain literal mass. Like it starts to look more bloated and fat looking even when he's diced. I've noticed this throughout all bodybuilders. As they get bigger, their face reflects their gain in size almost in parallel, at least in almost all cases, with the exception of certain guys. But typically the guys that it's not reflected in are guys that haven't crossed that threshold into like mass monster territory. And if you want to argue that, Phil Heath isn't a mass monster or whatever, there's lots of examples out there. I'm just using him as an example of, a guy whose face has morphed significantly, and it's through his process of gaining a significant amount of muscle. So as Dorian gains muscle, his face gains mass in parallel. And this is irrespective of water retention, irrespective of body fat, because these guys get diced like literally 4 to 5% dry on stage, and their faces still look fat. And the reason for this, I can't say I know for sure, but I think, at least I theorize, that as you gain muscle everywhere, your face is also a muscle. So you gain physical tissue in parallel. Like when you gain muscle across your body, you gain it everywhere. It's not just, in one place. It's not like you can spot gain on your shoulders unless, you use SEO or something like that, but that's not like actual like hypertrophy. That's, anyway, that's like manual fascial stretching. It's a bit different. When we're talking about like, if you gain 10 pounds of pure muscle, it gets distributed through your whole body. It's not like it goes to one area or another. So part of that is your face. And you'll notice these guys, as they gain muscle, their faces kind of grow in parallel. And Yates, the reason he's a good example is not only because he went all the way up to that bulked up face look, but he's also come all the way back down. And now in his downsized, older age, his face, arguably looks better than it did when he was massive. Even though he's way older, his face is way slimmer looking, even though he's obviously a higher body fat percentage relative to his, weight. And that's just, I just think that's what's happening. And it's really interesting. And you'll see Phil Heath is a great example too. When he first started, just, chiseled, diced face, sucked in, pretty much like.
Can you guys hear this video? Can you guys let me know? I know the screen is not sharing for whatever reason, but let me know if you can hear this.
Really, really good looking dude, honestly. And as he gains mass, you go from his first contest to nationals, he gets his pro card, his first few pro appearances, all the way until his first Olympia. And then throughout his Olympias, where he's attempted to play the size game with these guys who he sees as threats, like Kai Green, Big Ramy, etc., and he's tried to gain mass. Obviously, his gut gained size in parallel, but as he gained mass, his face noticeably chunked up, even though he'd still show up, hamstrings, glutes dialed in, as diced as he was in years past. But the only difference is he weighs more now, and his face is massive, even when he's diced. Kai Green, another great example. When he was an amateur, very lean, aesthetic.
More aesthetic face than at the end of his career. As he gains more mass, his face takes on a more, massive, bloated appearance, even though he's, shredded. And when you get to the end stage of his career,
walking around, standing on stage at like, I don't even know what he weighs, like probably like 260 plus, maybe even more, 270, 280, I don't even know. But the guy's obviously, gained probably like 100 pounds of muscle over his career from an amateur to being a top pro. And at the end of his career, even when he's completely just diced as hell, his face is like a big, like bloated looking block. And it's just, to me, it's almost like that. I've done a video on this before, how, when you take gear and you try to play this gain muscle game, or like, the mass game or whatever you want to call it, there's sort of like a trade-off of what you're, like, obviously you're going to lose. You're probably going to exacerbate your miniaturization of hair follicles and many other things. But in parallel, there's a certain threshold where gaining muscle makes your face look more masculine and better. But then there's also a threshold where when you're gaining more and taking absurd amounts of drugs to gain this muscle, that your face just starts gaining significant amount of mass and starts to take a downswing. And I think there's definitely a fine line in terms of not pushing yourself above and beyond this, unless your dream is to compete on the Olympia stage and you have the genetics for it. To me personally, I thought it was something interesting, and I haven't seen anybody make a video on it before. But there's countless examples. I'll throw some up in the corner here of guys who, when they were amateurs and they show up at the show, just completely peeled faces, very, very lean, chiseled looking. And then as they gain, 50, 60 pounds more muscle throughout their careers to be competitive at a very high level, even at the same body fat percentages, their faces just have so much extra mass on them in parallel with their bodies. And it's sort of, I think it's another reason to not, push things way above and beyond where you need to if you're not a competitive bodybuilder, because gaining muscle isn't always a positive thing. Besides, the cardiovascular stress, etc. Even if you're immune to hair loss, like it plays a diminishing role on your physical face. And I don't know if a lot of guys are aware of this. I think they kind of get into a downward spiral of gaining muscle, and before they know it, their facial aesthetics are like completely thrown off, and they don't realize why, or they just don't care because they're so massive it doesn't even matter to them. But just something to be aware of. I think that there's definitely a correlation between muscle and literal muscle on your face itself, and I've seen countless examples of it over the years, just as a fan and a spectator of the sport, and something to keep in mind, and something that is kind of interesting. Anyways, thought I'd make a quick video for that topic. Hope you guys enjoyed it. Please like, subscribe, check out my blog, moreplates.com. Check me out on Instagram at @moreplates_moredates. Talk to you guys soon.
Yeah. Hello. Yeah. So Shukai says it. Is if it's asking about. He's asking if it's just all soft tissue, and it is a lot of soft tissue, but it will grow the bone as well. And I do think that THC, to some extent, is not. It won't give you sleep apnea, but it can change the way that you are aroused from a lack of oxygen or a respiratory restriction. And it also it really is working through. It's basically sending a lot of GABA signaling, which is inhibitory, and which is basically how Xanax works, which is also going to help give you sleep apnea by relaxing the muscles. So,
yeah, I don't really know a whole lot about the effect of that, but one thing that was interesting that you brought up last stream was the effect of it changing like your head shape and therefore your hairline. So I thought that was like really interesting. Yeah. Jawley, want to give us an update on how the MSC face mask is going? I'm currently not wearing face mask right now. The MSC is all right. They had to push my date back a month, so I am now without a Hyrax expander or with anything for an entire month. So I'm kind of upset about that. And there's another month gone that I have to wait until I can get those arch wires put in. But whatever, fighting through it. So that's pretty much it. Question: I just started nose breathing recently, and I experienced runny nose when I go for walks. Is this something that goes away once the body adapts, or is it constant? This actually used to happen to me. I used to live in North Carolina. I had really bad allergies there. And I mean, I guess it's a bit different, but once those allergies went away, it didn't. But one thing I found that helps me fight through like that nose runniness or just, the stuffy nose when I'm walking or running was just trying to fight through it and by not like blowing your nose a lot. Just really fight through it. Your body is smart. It will dilate your nose so that you can breathe. So just it should go away with time as your body adapts to strictly nasal breathing. I would say it should take about 2 weeks, 3 weeks. I mean, that's how long it would take for me, like especially during like the allergy season. I would try to just fight through it, especially when I was running a lot. Yeah, that's one of those things where it can be beneficial, but you have to be careful. The HGH or the soft tissue that he was talking about.
Yeah.
Guys.
Well, long term, yeah, it causes a ton of water retention in between all sorts of tissues and your nerves, and literally every tissue will cause water retention. Yeah, so using that long term is not going to be a good idea. But
guys, what are your experiences with body systems like functional patterns, PRI? They give a lot of jaw growth alone. I don't know what that is.
Yeah, I think he's talking about Postural Restoration Institute, I believe. I like that channel a lot. Yeah, focused on the asymmetries that are caused by the differences in the sizes of the lungs. Your right lung is going to be larger because it doesn't have the heart competing for space basically in the rib cage, and so you have certain changes that happen where the rib cage and your hips will become tipped, and then that affects exactly how your head sits in your neck, and then how your jaw sits in your head. So doing a lot of those postural restoration things, as well as movements like to correct asymmetrical muscle and bone development will be helpful when you're getting these expansions done. Because if you don't, you're going to have way worse asymmetrical expansion.
One of my face is perfectly fine, but the other is just really meh and recessed. Like one side of my face grew correctly and the other didn't. Could MSC face mask fix just the one side? That is a very complicated question. If I had to
it's
guess,
possible, but
it
depends.
I
can make it worse too.
Yes, I developed an asymmetry and crossbite after MSE. And what Zabad told me was to wear face mask on one side more than the other. So like double up on rubber bands on one side. So it kind of helped, but I mean, structurally, the rest of the sutures and stuff, it really depends on what the placement of the MSC and if one side gets expanded more than the other, or that's a complicated question.
Mm-hmm.
It's not really natural to have human growth hormone.
Obviously, if it's exogenous, it's not natural, of course. But you do have growth hormone, obviously, your whole life, but not in the amounts like that all the time.
Look into flowability if you want to get into the body. It's super cool. I don't know what that is.
Yeah, I don't know.
I'll look it up though. I heard you're making a face mask of some sort, Jawley. Is this coming out soon? I'm aiming to having it come out in June or July. It's still being designed right now. I have the arch support. I have the posture corrector. I have the bar. I just have to either solder the wire or use airplane glue to do it. So we'll see what happens. From what I've seen, you could easily expand. You could just as easily expand on the side you don't want as you could expand on the side you do want.
Yeah, I think a lot of times people are talking about like their jaws being asymmetrical, but there's you don't really know where the asymmetry is originating from. Like, let me show you my X-rays here. Oh wait, yeah, can you see that? There we go. So if you look at this guy here, I asked Ron about this, and it looks almost like my head is tilted, but I've had several facial injuries, especially on this side, but the bones, like the asymmetry doesn't just exist like in your jaw, it really exists throughout your whole head. So if there's all these little bones all throughout here that can become easily cracked, just like your septum, like the bone behind your septum, and influence the way that the jaw sits in the head. And then often you'll have like a decent symmetrical jaw, but you won't have the jaw sitting into the skull symmetrically. So you're going to just there's no way of predicting whether the side that's lower or higher is going to expand more. And Ron's talked about this in several videos and different examples with, I think, I forget his name, where he had super canted smile. A lot of people have it. It's not the worst thing in the world, but
Bro, I'm 16. Just got my traditional braces off. I can breathe with the back of my tongue up. Started mewing while 15 using braces. Should I continue mewing? If yes, should I not use retainers? Continue mewing and continue wearing the retainers. Absolutely. Don't stop mewing. Don't stop wearing the retainer. You're what, 16? Yeah, bro. I would continue to actively mew. Wear the retainer. Actually, that's a good thing you have the retainer. And that you're consistent with it. But have you noticed any sort of changes in your profile that were negative? Or, I mean, you're saying you can mew with the back of your tongue up, so I'm assuming you still have your wisdom teeth. So I would continue.
if you can breathe with the back of your tongue up, this is a test for people that are wondering about sleep apnea. So get into that position with your bite, normal suction mew, right, and the hold, right, and breathe through your nose, and lay down either on your back or on your side, however you normally would sleep with a pillow. And really, really, as much as you can, relax every muscle in your body. It's going to help simulate as much as you can while you're awake the musculature position that that you're going to have during your sleep. And as long as you can, because a lot of people can do that during the day, but then when they fall asleep, they don't do it because they're not like conscious of it, and they can't change it. So test for that, because if you can't breathe through your nose in your sleep, it doesn't matter if you can do it during the day. It's better than mouth breathing all day, but
Dr. Zaggy's tongue tie release.
no, not the guy, but yeah, we're somewhat familiar with tongue tie release. I think Ron had it, right?
Yeah, phrenectomy.
Yeah, I might get it.
Same.
Not sure. I don't know if I need
Yeah,
it.
man. I'm not sure if anyone has any more questions, but I don't really. Ethan, do you have anything else you want to talk about or get into today?
Not off the top of my head, but we can find something. Yeah, it'd be good. It'd be good if anyone else has any questions, put them in the comments, and we can talk about OPP, who probably is watching, who did a cycle of MK677 when he was 16 to 17 to try to grow taller.
Bruh.
But oh, here. Oh yeah, here we go. There he is. Yeah. So did you can you answer if you did the 2,000 milligrams over? You clearly didn't do 2,000 milligrams every day, correct? It was just like how many milligrams did you do per day? But no, especially if you're not on anymore, it's not that it causes organ damage. It just will grow your organs. But anything that you're not gonna have any. No, I wouldn't worry about that. Especially if you've already felt fine. Yeah, 10 milligrams is really low dose. Yeah, you're fine. Yeah, I wouldn't worry about that. Yeah, it is very helpful to if you wanna why don't you put if you could Ferb put a little paragraph description of what your experiment was and what your purpose was, and then we'll put that on screen so people can see. We can talk about it. But yeah, very important to cycle this stuff.
So for those who don't know, what is MK? Like, what is this? What is he talking about?
Yeah, so let me get this up. So it's a compound that was developed. I don't know if it was in people that that didn't have appetites, or people that had growth hormone deficiencies. But essentially, there's a hormone called ghrelin that is a signal that's sent when you're hungry. So you have your biggest spike is during the morning, and then you have several during the day, and it will cause you to want to eat, right? And so, but what the ghrelin hormone does is binds to a receptor in the pituitary, and it basically it's the growth hormone releasing receptor. I don't know the exact name, but it tells the ghrelin, the endogenous hormone, the one that's already in your body, sends the signal to release your own endogenous growth hormone, and you have like 4, maybe 5 specific versions of growth hormone that you release, and so MK677 basically mimics ghrelin, so it's a ghrelin mimetic, and binds to the same receptor, causing a lot of growth hormone release. And then downstream of that causes a lot of insulin and IGF-1 signaling. So it's essentially mimicking, let me show you the structure here. Essentially mimicking ghrelin. And where is it? I like looking at a lot of this, a lot of these structures. But yeah, this is a molecule. And let's see. Did this guy? Oh, there we go. Yeah. So put this comment up about his experience. So I could pull up some studies, but essentially when you're growing, right, you have the epiphyseal plates that are separating different parts of the bone, right, and allowing the bone to expand from different segments. And so during your puberty, you have a giant increase in growth hormone secretion, right, ghrelin secretion, because that's why you get so much more hungry when you're going through puberty, is the ghrelin, and that's why you grow taller during puberty. And then you have a ton of androgens, more than you'll ever have in your whole life for a few years. But after a few years of puberty, there's a spike in estrogen basically that triggers the closing of the growth plates, and hardens them. And so the reason this guy Ferb, he mentioned to me that he introduced the melatonin to counteract estrogen. And so personally, I don't think that's the best way to do it. It's definitely not. But the reason you'd want to do that is to delay the growth plate closure. And if you look at people with idiopathic short stature, which means like you're an adult and you might have normal androgens, you might not, but you're pretty much an adult, but you haven't gone through the same growth that a normal person would. And they'll basically take absurd amounts of growth hormone directly, not MK677 or anything, and then not suicidal as in like the extremely high doses of aromatase inhibitors, which are essentially blocking the testosterone from converting into estrogen, which is what is responsible for that growth plate closure. So if you do that young enough, you just delay the closure for long enough, combining it with the growth hormone. It can cause, when you combine them, it's extremely effective at treating people with idiopathic short stature. But the doses of AIs they use, the aromatase inhibitors, you would never want to use them, especially if you're healthy. But his idea was to try to counteract estrogen with melatonin, which is not really how you want to do it, especially because melatonin shuts down your own hormone production to a small extent. But there's definitely, if you're young enough, and clearly, I mean, people are clearly, because I know I asked, we were talking about this in the chat, and clearly people will experiment regardless of what people say. So for people around that age, you don't want to, if you're going to do something like that, you want to either inhibit estrogen from forming from aromatase, or you want to block the estrogen receptors in the brain with something like Clomid, or like actually blocking and antagonizing the estrogen receptor, so your brain can't get the signal of estrogen. That will help grow people to some extent. Not everyone will do that, but I believe that you said you grew a few inches, correct? it's everyone grows at different points in their life. Like I personally completely stopped growing when I was about his age, 16, 17. So you'll never know, which 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 one. Yeah, 2 inches. Um, yeah, you'll never know exactly which one caused the change, but it's not. There's in the studies where they treat the short stature, it's really not safe to have completely no estrogen, and it can cause these weird growths on your spine. But they're using doses that no one would ever use. So you just need to be extreme. You need to get blood work done if you're going to do it, ideally, and inhibit it enough that you can get the benefit without completely getting rid of all estrogen. Um,
BioBlock is John Mewes on JawHacks podcast. He said BioBlock is superior to MSE because it's holistic, gives three-dimensional growth, and makes you mew during your sleep. Wow, I love the words.
Yeah, I don't know.
Yeah, I don't know. I think
if you're young enough.
But... Yeah, exactly. But I think it's not really black and white when it comes to tooth-borne expanders in adults. I think women, and maybe if it just depends. Like I think it's worth trying those tooth-borne expanders. Specifically, I've seen a lot of craze about BioBlock, but I saw the same craze about HomeoBlock just a fucking year ago. So, let's see. More studies and more questions need to be asked before that can be considered superior to MSE. But yeah, no.
Mm-hmm.
One of the best ways to actually increase testosterone, speaking of 3xing it, is to fast or long periods of time, and to be more specific, 3 to 5 days. Fasting for 3 to 5 days is insane. I could see intermittent fasting where you go a while for, all day.
Well, it's certainly difficult to do, but it's not crazy.
I'm just a pussy, and I like my food, so
yeah. Dude, I've done some longer fasts like that, and the guy's definitely right that it will increase it like that. If you do it cyclically enough, it may increase the baseline testosterone production, but that's the more difficult part, is getting the actual baseline average to change. Unless you're really, if you really actually can fast 3 to 5 days a month, that would be beneficial for you for sure if you can do that, because it's also increasing a lot of, think about it. So the ghrelin hormone, the hunger hormone, right, is increasing a ton when you're fasting, and you get a lot of growth hormone release as well when you're fasting.
That's really interesting. Yeah. I've always thought about fasting, but I'm just weak. Bro, just lift heavy ass weights.
It gets easier.
That's how you increase the baseline. Test max is out at 48 hours. That's the peak time. Can you react to a comment on Patreon Q&A session where a guy says his teeth got destroyed by taping his teeth? What the fuck? Why would you tape your teeth? Yeah, I'm assuming mouth taping, but what? Can you guys tell if he's real or no? Comments or name, Ultimate Chakra. Patreon Q&A session is very vague. I'm sorry. I'm not going to look it up. But I mean, mouth taping is one thing, but to tape your teeth, bro, you're just asking for some problems. Saliva is very good and healthy for your teeth, which is why I am avoiding Invisalign for my post-treatment of expansion, or post-expansion mouth taping, my bad. Yeah, I don't know.
Yeah, give more information.
Yeah, sorry, I don't know. I don't feel like looking up the comment, but could you just copy and paste it, please, if you could? Where guy says his teeth got destroyed, but what the fuck, bro?
Oh yeah, he said mouth taping.
Yeah. It's orthotropium.
I don't see how that would destroy your teeth, but
yeah, me neither. I think it would, if anything, it would help your teeth. What's the problem with BioBlock? If it's not double jaw surgery, it won't work. Hey, Daniel. Hey, watch your mouth there, buddy. Hey, MSC works. Okay. Watch
Well,
yourself.
you guys, so many of you guys are so fucking black and white. Like this is it's so nuanced, guys. Like it's not that one thing works or it doesn't work.
Life is gray, my friend.
Well, like it just depends on what the mechanism for your sleep apnea is. I mean, because literally I saw Yusefian. If you guys watch Yusefian's interview, he treated this guy in his 60s or 70s with an AHI in the 60s or 70s, and he got his AHI down to single digits with just the MSE and the DAME, the lower expansion, and that's not going to work for everybody. But I mean, it's not like those. I mean, clearly the BioBlock is giving you a way less benefit and expansion, and way less likelihood that it will actually cause any skeletal expansion. But maybe for someone with like super soft bone, super soft sutures and minor sleep apnea, it might be able to help. But yeah, obviously the double jaw surgery is going to give you the most dramatic change at once. But you don't just want to go into any invasive procedure just immediately.
I think more study and research needs to be done on tooth-borne expanders in adults, specifically BioBlock, and anything similar to that. I just personally wouldn't do it for true skeletal expansion. Maybe if you just want to tip the teeth, go ahead. But if you're old as fuck, like 40, 50, and you want to get a little bit of oral volume, then by all means do it. But even then, I'd be worried about your teeth falling out and shit.
Yeah.
Comment ultimate chakra. Okay, wait. Sort by. Oh, there it is. Dang, 70 replies. That's crazy. All right. I damaged my teeth following your advice. Holy shit. You weren't kidding. I couldn't breathe that night. That's crazy. Can you hear me?
Yeah.
Okay. I made a video advising people to eat hard food, and again, it damaged my teeth because hard food are more likely to crack teeth, and crunching is very abrasive.
It's not.
Okay,
See,
that's not what he meant, bro.
Yeah.
You're dumb as fuck. You did this to yourself. 6 of my teeth were damaged because I was diligent in taking your advice. See, this feels like somebody hates him. This feels like, or he's just really retarded.
People,
like,
people just put too much faith in their interpretation of what their advice is. But
right.
I don't think. Yeah, I agree that like eating crunchy food is really, in general, is really not good for your teeth.
Absolutely.
But like eating carrots is really not good compared to chewing a tough steak. Like a tough steak it's chewy and it's soft, so you're not
That's
gonna crack your teeth. Yeah.
Not fucking hard pieces of candy like a jawbreaker, you dumb fuck. However, this does not change the symmetry of my face. I actually agree with that. I mean, why would it? Especially if you're an adult.
It seemed like this guy tried to do it when he had trouble nose breathing, and that's why he's grinding his teeth. But I don't know.
As an adult, I mean, he isn't wrong. Now, another thing you need to delete off your channel is the idea that our diet is the reason. What? That is a lie. The reason why I put my tongue in the right place because my parents were smokers and they had mental health. Jeez. And they were newborn babies, which caused me to be unable to breathe. I mean, that is true. This gentleman seems to be in his possibly early to late 40s, late 50s. Unless his parents were just really inbred and didn't really think, oh, well, yeah, trust me. Well, it seems like he's blaming Mike Mew for all of his personal problems.
Yeah.
I'm a 3 out of 10. Yeah, these people, I mean, I don't want to be, if your parents smoke, okay, these are exceptions to a philosophy that Mike is, expressing. Wow. I mean, I don't know what to say to you, bro. I mean, interesting. I don't know. I think the bullshit about grinding your teeth, not brushing your teeth. I mean,
he didn't brush his teeth.
I mean, I'm just saying, if your teeth are falling out and that's the type of shit you're trying to avoid, I just don't understand like why it wouldn't work unless you're doing something wrong. People didn't even hardly do piezo surgical cysts a couple years ago. They're doing new things that haven't been tried before. That is true. I guess it's individual to individual basis because as Dubad, and he said it's all about the hands of the ortho, but no matter what ortho, AGA is crap. Yep, I agree. I think AGA and HomeoBlock and all of those devices are very, very similar. They try to do the same thing. It's like just children expanders and adults. Like, what do you think? How is that going to work? I don't think. I mean, it might alveolarly, but I just don't see it doing anything like actually useful. I was just seeing your video with Ron, and you talked about asymmetry. Have you noticed any asymmetrical expansion with MSE, and if so, how are you reducing it?
So I have not. I don't have MSE yet. I'm getting treated with Dr. Yusefian soon, but that will be in a few months that I'll have the lower and upper expander. But someone mentioned the PRI, the Postural Restoration Institute. Though that is probably the most effective thing that you can do to reduce the asymmetry, because you need to reduce the asymmetry throughout your entire body, and especially the neck. So definitely stretching all the tissues, all the muscles, as much as you can throughout your neck. I do a lot of these stretches, this sort of thing, like this way, anything you really can. But getting your hips even with your shoulders as much as you can, and getting out of forward head posture. A lot of times people will be using their phones in one hand, or like everybody leans on one arm. I often lean on my left arm, right? I go like this, I look at my phone, and doing any sort of behavior like that before and after and during the expansion is just going to confirm what asymmetry is already there. But you're never going to be able to get rid of skeletal asymmetries that happen deep inside your skull and behind your palate. But as Ron has reiterated, it's you're skeletally expanding and then correcting for the asymmetry with moving teeth as much as you can. But you're not going to be able to get rid of a inherent large asymmetry.
Will your condyles removal after you complete MSA treatment and realign all the teeth? Remodel. I'm sorry.
Yeah. Well, they won't realign the teeth. I mean, the condyles have nothing. Well, they do have to do with the teeth, but the remodeling of the teeth is really going to happen if you're just getting MSE done. It's going to happen when the lower jaw, if you're not expanding the lower jaw, which I am, it's going to tip the teeth backwards and realign them to find the new bite, but that's why I'm getting the lower and upper done. But the condyles will remodel to a certain extent. If you're, if you guys know what condylar resorption is, where one of your condyles gets shrunk from force into the TMJ, and that is it can happen in men, but it's way more common in women with connective tissue disorders. But just women in general, it's more common in. So they'll be more prone to remodeling and more prone to the forces involved in the jaw and chewing. But yeah, they will remodel to a certain extent.
Ethan, I do gotta go. I gotta dip.
All right.
It's about that time. But thank you everybody for joining us today. We really appreciate everyone. EJ, wait, before we leave, there's a very interesting question that I know you want to expand on. But
Oh,
I give
so
about 5 minutes, 10 minutes, and then I gotta go.
yeah. All right. Well, yeah. You need, if you really want to do that, you can do it, but you need to, if you can afford some blood work, that will really, really help you. Um, Letrozole is a very intense AI, and I personally would not use letrozole. I just think there's better options that cause less side effects. But um, if you, EJ, if you go in the Discord, we can talk a bit and chat about some options with that. But I personally would either look into one. Well, I would look into I think aromacin or enclomiphene, which is not an AI, but um, I think very, very small doses. You have to really, really have to titrate the doses because a lot of them will come in a single pill that has, whatever, 25 milligrams of something. But when you're a male, you already have extremely low amounts of estrogen, and you do not want to have crushed estrogen. You're going to feel like crap. Um, And so you need to, if you can get some blood work and have a baseline of the estrogen, um, and introduce, let's say if the standard dose is 25 milligrams of aromacin or exemestane, which is the same thing, you'll split it up into, let's say, 5 milligrams and take that one day, take it basically, let's say, every other day for a week, and you need to look, during that time frame, check out the side effects of having low estrogen and really, really watch out for those because you'll notice them immediately. Like I've played around with actually not chemical AIs, but plant-based AIs, and you'll notice joint pain. A lot of people will notice joint pain. You can have eye issues. You can have low libido, all sorts of things. So you really want to be careful with it, and do it. You want to just you really, what you're trying to do if you're trying to actually grow in that way during that period is you're trying to suppress the spike in the estrogen that causes the growth plates to close. You're not trying to just completely crush your estrogen, in the way that they do with those studies, with people that are chronically short, or short stature medically, and they use letrozole in those studies. I think that are very intense AIs at extremely high doses, but that's because there's an issue there. If you don't have an issue and you just want to try to experiment, you need so little. You might only need to take 1 to 5 milligrams like once or twice a week. You need to really, really be careful with it. And as well with the MK, I would cycle that between a growth hormone releasing peptide, which is not the same thing. But again, you're not going to stay on these long term. So this is not, it's more okay if you're going to do this for a year or two to have this growth hormone be higher for a year, for that period of time, is because you're going to get off of it. But the estrogen shouldn't rebound a ton if you do it slowly. But again, this is not like there's absolutely no research with people that are at a healthy height that are experimenting on themselves. So you're not going to get a clear answer. You just need to be extremely meticulous and do blood work if you can. And definitely, if you're really trying to do that, do inversion tables and stretching, working out, etc. That will help a lot. Get your diet and sleep obviously under control. So yeah, I'm getting, well, Dame. Okay, can you go to Hassan's comment? Yeah, so Dame is the what the hell does it stand for? Anyway, it basically, Dame is just Yousefian's term for MSDO, but he does it slightly differently because the MSDO is mandibular midline distraction, right? Osteogenesis. So they'll split in between the bottom two teeth, right in the middle. But with Dame, he'll do it sometimes off center on one side between one of the two teeth to get asymmetrical expansion. So if you have one jaw that's smaller or shorter, you'll get one grow larger and one grow a little bit less. But yes, I'm getting Dame. I'm not sure. I believe it will just be midline, but yeah, I'll keep you updated on that and give you some information once I get it treated. That should be in a few months, but yeah. Yeah.
If I were you, I wouldn't get BioBlock. Just look here. Let's think back to the HomeoBlock guy on Ron's YouTube channel who got absolutely fucked and went insane. And then I'm not saying you're gonna go insane, but I don't think any tooth-borne expander, especially as a male, should be done. Unless you want to achieve on like just 2 millimeters, 3 millimeters of expansion just by tipping the teeth, then okay, sure. But even then, it's not worth it, bro. They wanted to charge me $10K, or I think it was like $8K, $7K, 7.5 to get a HomeoBlock on and then an additional $1,000 for the frenectomy, and then an additional couple thousand for post treatment. So I don't think it's just not worth it. It's not worth it, bro.
Yeah. Shuka, I don't know if you're asking about the MyDame, but I'm not sure if I'm doing midline or slightly off center yet, but I will let you know on that. Hassan, we don't have time to talk about this right now, but please message me.
Join the Discord.
Or follow me on YouTube and send me. I don't know if you could send me a message or comment or something, but there's you don't want to mess around with it. So I mean, I'm not an expert on this stuff, but I have some knowledge about it. So, but hexarelin is probably the only thing that I would replace with something else. But in terms of increasing it naturally, there's not a lot of things that you can do to increase the baseline naturally, but you can increase it in spurts. So like if you have the main one people know about is if you have 4 sessions, 30 minutes each in the sauna, 5-10 minutes cool down, not in cool water, that can increase it 10 to 15 times baseline afterwards for a day or two. But if you do it more often than that, you won't get the same increase. It's somewhat static, but if you're really trying to do that to do any sort of height gain, you really should actually do it with, in my opinion, with growth hormone related compounds. You're not going to be able to probably to afford regular growth hormone, and I think it's actually better to, like, when you have just growth hormone, it's only one type of growth hormone. But if you with MK677 or the growth hormone releasing peptides, they release it releases the endogenous growth hormone from your brain. And there's a bunch of different types of them. So you'll get a way better balance of all of them instead of just one type of them. So yeah. So just message me in the Discord, and then what's his face, EJ, if you're still in here, also message me about that, and we could start a chat about this. Because I don't want to have to type this or talk about it so many different times, but you will
please join the Discord if you guys haven't already. And again,
and I might make a video on my channel or something about ways that people could go about doing that. But
yeah, man. It was good talking to you again, and it was good being here and getting to talk about everything. Hopefully next Saturday we can go live again and shoot the shit, motherfucking talk. But yeah, guys, thank you again for joining us and for being a part of this live stream. We really appreciate all of you. And until next time, take it easy. Love you guys. Daniel, Shukai, all of y'all, really appreciate it. Again, thank you, Ethan, for your knowledge and wisdom. And Yeah, that's it. We're gonna be out of here. So
yeah. All right, join Discord. Have a good one, guys.
See y'all.